Hey, good evening, Mountain House. This is Brian Harrison, the editor and publisher of Mountain House Matters, and you are here for episode number 3 of our Mountain House Health Matters with Dr. Sadia Khan-Chatouri from the Assured Primary and Urgent Care Facility. And his neighbor is with us here, his business neighbor, Dr. Raman Singh from Elite Dental Group. And we are going to have a conversation about two things. We're going to look at some oral care awareness, oral cancer possibilities, and we also want to look at allergies. So before we get into that, though, I did want to tell you, you should have gotten your latest copy of the Mountain House Matters newspaper in your mail. If you didn't get it, comment or reach out to me and we'll get you a copy, or you can find it at Town Hall or in the library or various other locations. I think we might have one or two in your store.
Yeah, in the office, yes.
I wanted to point out, though, this weekend you've probably seen signs around town for the, the 17th annual Mountain House Citywide Garage Sales event. It's going to be May 3rd and 4th. We've got, last I checked, which was a few days ago, we had 126 homes registered to participate. We encourage more. We usually end up having about 150. We've experimented over the years of splitting up the villages and trying as many as 3 different weekends where we had segments of town, a couple of villages at a time, basically. And that just wasn't very effective. The first weekend was pretty good, and then after that, it fell off. And by the 3rd weekend, people weren't getting very good turnouts. So we decided, granted, it might be hard for people to get to 150 garage sales in one weekend. One of the things that we've been able to do is make our map. We have a live map that people can tune into and press the buttons, and it goes to the different addresses, and each one that pops up will actually show you the main items that they have for sale. We're also going to be putting out a list, hopefully, well, it'll have to be tomorrow. I'm going to put out a list of just a spreadsheet of the addresses and the main items they have for sale, so you'll have one place. I've had at least a couple people ask me for that, so I was thinking we might not need to do that. But if you want to go see the map, go to mhmatters.net. It's on the home page, and you can go to the map there. You can also register to participate there if you haven't already signed up and you still want to. I will be adding addresses as they come in, and I'll check it even probably up until Saturday morning. You can do your garage sale both days, May 3rd and 4th, Saturday and Sunday, or you can choose which day you want to do it and just have a one-day sale. Of course, we encourage you to do both days. I think it's probably more effective, but it's a bigger commitment for you with your stuff. Anyway, garage sales are always popular, and this was started by Jim Lamb years ago, and when he and Heather moved away, he thought it most appropriate for Mountain House Matters to host this event. So that's how I got wrangled into it. And it's always a popular event, so we're happy to do it. You should see signs around town. If you can't find the information here, you can find it there. So there's at the entrance to Central Park, I know there's one. There's a sign on Arnado right by where we are at. We're coming to you live from Zaytech Studios in the old CSD boardroom before we were a city. So we're happy to be here. Anyway, with all that said, let's get on to our main event. You'll find on your page 23, and I guess I didn't have it on the cover this time. Page 23 will show you just an image of what we're doing here tonight. Dr. Chatouri came to me toward the beginning of the year, and we first talked about doing a regular, hopefully monthly event where we talk about some health concerns. The very first one you can find on our YouTube channel. Maybe if you dig on the Facebook channel page as well, but on the YouTube, it's at Mountain House Matters, youtube.com/@Mountain House Matters, all one word, to take you to MoHoTV, and you can find the episode. The first one we did in your living room. I'd like to welcome Dr. Chituri, Dr. Singh. Thank you both for being here this evening. And
Thank you.
I'm probably going to pretty much just pass it off to you to take the lead and go from there. Our first episode we did in his bedroom with both of us at the same computer because we were having technical difficulties, and it worked out though.
Yeah.
And it was a very informative.
It was a good start.
It was a very informative thing. That was in January, I think. So anyway, Dr. Chituri, if you want to just introduce yourself a little bit.
Yeah. I'm Dr. Chituri. Hello again. I've been with this episodes. This is our third episode doing together. Today we have our distinguished guest, Dr. Singh from Elite Dental Care. Thank you, Dr. Singh, for being here. So on today's episode, we are going to discuss two topics. The most important topic for today will be about oral cancer. April is the Oral Cancer Awareness Month. We chose this topic mainly because oral cancer is one of the cancers that is preventable with early detection. And also, oral cancer happens to affect younger population, relatively younger population than elders. And it has a very harsh effect on the patient's health, leading to death. So this cancer needs to be taken very seriously, and Dr. Singh is here to enlighten us about the cancer. Hi, Dr. Singh. Hi. Would you like to introduce yourself?
This is Dr. Singh from Elite Dental Care from Tracy and Mountain House office. I'm a
think the
general
mic
dentist and I do see
I might
patients.
have to move that closer to you. I asked him to turn it off in the room because the echo was.
I'm a general dentist and I do implants, Invisalign. I see patients from all ages, from kids to adults and elderly population. So in my practice of 20 years, I have seen patients across the board having gum disease, cavities, caries, edentulous, like patients who doesn't have teeth at all. We do diagnose patients for cancerous lesions. Very often we see some patients who have a gum disease. We always tell them to take care of a hygiene. So hygiene plays a very important role on patients who are the predisposing factors in them for getting diagnosed for kind of cancer or precarious lesions. Most of the patients who are smokers, they are prone to cancer. That's very important. Some patients who don't smoke but they inhale smoke, that's another one. Patients who are drinking, who are chronic drinkers, they can get cancer lesions too. So it is all with the patient education.
That's a good point, Dr. Singh, that you mentioned. I mean, most of us know that smokers and tobacco chewers have a high incidence of cancer. But you brought up a good point about drinking. I don't think many, even until now, I didn't even know that drinking is a predisposing factor for oral cancer.
It starts from there. So a lot of patients, they are not aware of it. And when they get aware, it's too late.
Okay.
So patients who are taking care of their hygiene is.
So that's also important to maintain good oral hygiene, having 6 monthly cleaning and all those things.
Yeah, patient education is very important. So patients who think that going to dentist only once in a while or when they have a toothache,
Right.
no, that's not good.
Yeah.
So they need to make a habit of seeing dentists every 6 months.
Yeah, that's good to know. So to our viewers, common risk factors would be smoking, tobacco chewing, and what else? Alcohol drinking, and most importantly, oral hygiene. That's so. What do you suggest for oral hygiene for our viewers?
Oral hygiene can be practiced by the patient itself. Apart from going to dentist, getting the cleaning or regular cleaning checkup done at home, if they are using mouthwash every day, flossing, of course their food habits makes a difference.
Yeah.
So people who are smokers, then if they don't get their teeth cleaned, obviously their teeth are getting damaged, their gums are getting damaged.
Right. When you mentioned about smoking, even passive smoking is possibly, even if you don't smoke, if people around you smoke, and also the smoke gets into your clothes and your jackets and stuff, it sticks on there for months together. So probably that is also a risk factor.
Second-hand smoke is risk factor.
Risk factor.
Yes.
That's good to know. That's good to know.
Have there been advancements in treatment of those types of cancer? I know when I was much younger, I saw special TV report about mouth cancer that was from tobacco chewing, and they showed it scared the hell out of me because I was never going to chew tobacco after seeing that, because they were showing how people actually lost their whole jaws, and
Correct.
it just was really pretty nasty. Has there, and if they could stop the cancer, I guess then you do what you have to do, and
Right.
you suffer the consequences. But have there been any advancements in how they treat that that's not so drastic,
Well,
or
if
it's a
they're
matter of
diagnosed
catching
in the
it?
early stages, then yes, they can be treated well.
matter of
and you can
catching it
save
early.
somebody, yeah, but if it's terminal stage and too late, it's hard to I've seen patients losing their jaws.
Yeah, and they should be
Yeah.
on tube feeding
Yeah.
for the rest
Yeah,
of their lives,
yeah.
which has its own
It
risk.
just does not
Correct.
look
Yeah.
like a fun way to live.
Yeah.
But so that really is another reason for people to maintain regular visits with their healthcare
Yes.
professionals.
Exactly, yeah.
So one thing I would like to mention in regards to the risk factors is HPV. So what are your thoughts on HPV, human papillomavirus, which is a known risk factor for cervical cancer? Women usually get pap smear every 2 years for that. So there have been studies showing that this can be contributing to the oral cancer as well. What are your
It
thoughts on
has to
that?
be diagnosed. It has to be initially diagnosed in early stages. You can't transmit the disease from one person to another, right?
Right.
So if it's not diagnosed, it's going to increase.
So HPV can be contributing to
Yeah.
that, right? So what are the common locations on your oral cavity that can have the cancer, and how does the cancer present in the initial stage?
Most of the times, what we see is on the floor of the mouth,
Okay.
on the side of the tongue.
Side of the tongue, okay.
Yeah, so those are the two common areas where we normally see during the examination that the patient has some kind of lesion or something. And very rarely you can see patients having oral pharyngeal cancer too, which is inside the throat area. And other areas where we see is on the lip.
On the lip, okay.
Yes. So those are the most predominant areas where we can see and tell the patients have a cancerous lesion, so they need to be diagnosed and treated for those, yes.
So,
And sometimes we see on the palate.
palate, okay.
Yes.
Yeah. So will doing a biopsy be the first step for it? And will the primary dentist be able to do the biopsy, or do we need to
Primary
do?
dentists don't do the biopsies, only done by specialists.
Okay.
So first it has to be diagnosed, so when they do the diagnosis by specialists, they of course they do the biopsy, yes.
Okay.
They do take the history of the patient, ask all details, and then they pinpoint, okay, this is the diagnosis of the cancer they have. So that is mostly done by specialists, yeah.
So this cancer looks like non-healing ulcer,
Ulcer, yes,
more like a
correct.
stress ulcer. People
Yes.
might neglect it, thinking that it's a common ulcer and just leave it, but it can be cancerous. So it's important for the patients to mention to their primary dentist when they go see them that they have this ulcer and stuff, because sometimes dentists might miss it, like it's a small ulcer, they might not see it. And if you wait for 6 months to 1 year, the ulcer can become bigger.
No, ulcer
Yeah.
doesn't take long to heal, but
Yeah.
if it's a non-healing ulcer,
Non-healing.
then there's something.
That's good
can
point,
be
no,
looked into
yeah.
there, but then of course the patient should look into that, okay, it's not healing, I
Yeah.
need to see a dentist.
Right.
And of course, dentist will see there that, okay, this ulcer has been sitting there in the mouth for at least a month,
Yeah.
right? So obviously something is going on.
Yeah.
So if you've had something for a month or so and it's not
Yeah.
getting better,
Exactly.
do something.
Yeah.
That's good, yeah.
Yeah.
Because as I said, stress ulcers, like after ulcers, might heal maybe in a week or two.
Yeah.
And, but this one is, a month might be a good time frame to get checked.
Exactly. Sometimes patients have autoimmune disease and certain things doesn't heal, but still it's better to
Right.
bring attention to
Yeah.
the physician or a dentist. You know, most likely if there are some ulcers happening, then they call the dentist or they call the doctor, but if the doctor can't diagnose, they send to the dentist. So
Yeah.
either way, they have to be diagnosed, yes.
Right, right. And regarding the treatment, is it mostly referral to the oral surgeon, or who will be the one pioneering the treatment? Like,
Most
okay,
of the treatments are handled by the surgeons.
Oral surgeon,
Depending
okay.
on what is the scope of the treatment
Mm,
plan or the
okay.
modalities they have, is sometimes they do medications can help if the early stages,
yeah,
or chemotherapy or surgery, you know.
Right.
It depends how far the cancer has spread to other
Right.
parts of the mouth or something like that. But
Right.
it has to be done by a specialist who knows what to do.
I think the treatment ranges from either just excision of the lesion, just removal of the small lesion, up to even terminal hospice to death.
Correct.
Right? It can be stage 4.
Depends on the extent
the
of
way,
the
the
injury,
timing
yes.
of diagnosis. So
Correct,
early
yeah.
detection and diagnosis is very
Exactly,
important.
yeah.
Okay.
So
Do you,
if I can ask, Dr. Chituri, if you see a patient who has a lesion of some kind, if you're just doing a general exam, would you then send them to the dentist, or would you just send them to a cancer specialist?
so if the cancer is widespread by the time they come see me in a primary care physician's office, if it's very clear, we would send them to oral surgeon right away. But if it's a small ulcer, we would rather send to dentist first, because it is
Double check it,
easier
basically.
and quicker to get an appointment with the dentist,
Yeah.
primary dentist, rather than this oral surgeon,
Very
which
good
is
point,
far away.
yeah.
Yeah.
Getting into a
So
specialist
that will
can take a
further
while.
delay. If the primary dentist confirms that if it's a cancer, they might be able to get an earlier appointment with the oral surgeon, rather than not diagnosing and leaving for the referral.
And giving it more time to get worse.
Right. Right. Do you have you seen patients coming to you after completion of treatment
From the cancer?
from the cancer?
No.
Usually.
Yeah, mostly they're handled by the oral surgeons or the cancer specialists.
Do you suggest any post-treatment surveillance for the patients?
We do follow up I have come across a couple of patients in my office, so they were operated on there in UCSF. So that patient was taken care of. She was survivor basically. It was her luck.
Good.
And she got that cancer because she was wearing a denture. It was ill-fitting, and over months and months that thing spread.
That's a very
Wow.
good
So
point.
she was taken care on the time.
And she probably thought it was just
Exactly,
irritated
yeah.
from the denture.
And then
huh?
she came to me, I want to make a new denture. I said, okay, I'll make a new denture. Then I'm looking in her mouth, I said, something is not right there, so that needs to be checked. So I referred her out. So she ended up going to UCSF and then
You
got
saved her life.
taken care of surgery there. And then she came back after, I think, a year. Then I asked her, I said, how are you feeling? She said, I got the surgery. She gave me a whole history behind it. Okay, this is what they did.
Mhm.
And now I feel better. My denture is fixed and I'm doing good. So very rarely we come across some patients in the office who has gone through cancer treatment and they are gone better, yes.
So the ill-fitting dentures can also be a.
Could be a reason, yes.
So anything that causes a non-healing
It's
ulcer
irritation
can
to
be
the area,
irritation,
right?
yeah.
It's chronic irritation and it's happening and then it becomes infected and a lot of reasons come. Is of course there are other systematic diseases if you have that can add to it, but
Mm.
in her case it was the one of the reason that's what they spotted out.
So viewers with dentures, be careful. Even if you're not smoker, the dentures can get you cancer. All right. Any tips or suggestions for our viewers, Dr. Singh?
The only one thing I suggest is just take care of your hygiene and just have a periodic checkup done by the general dentist, for teeth and gums. As long as you're getting your teeth checked, gums checked every 6 months, I think that would help to keep these diseases away. Don't go to dentist only when the tooth aches. That's wrong thing, means a lot of patients, they think, I should only go when the tooth is aching.
Right.
No, then it's too late.
So go to the dentist before the tooth aches.
Correct. So if you're doing every 6 months, you will
Yeah.
not have a ache because it can be diagnosed and
Correct.
treated on time.
Correct. Correct. Yes.
A lot of patients have phobia about dentists. That's true. I know that a lot of patients don't want to see a dentist. It's because of phobia, dental phobia. It's hard to get them out. But remember, when the toothache comes, it's unbearable. So you have to make sure that if you're going on timely, whether it's to dentist and dentist checks and diagnoses and treats, you would not see that painful day.
Right.
So look at your dentist as your friend,
Exactly.
Right.
Yes.
not somebody to be afraid of.
Exactly. Yeah.
Well, and pain management has come a long way over the years too.
Yeah.
So you're not going to have to suffer a lot of
Right.
pain like probably used to be.
Right. And sometimes patients have the phobia because they had a bad
Bad
memories,
experience.
bad
Yeah,
experience. They don't want to see it.
I was one of those.
Yeah.
Took me a long time to get over that, but
I know.
Mhm.
I finally got to where I got on the regular schedule of the 6-month checkups and
Correct.
then it's no big deal. It's just part of what you
Just
do.
like a maintenance, right? Means you maintain your cars, right? You go and get your oil
Exactly.
change every 3,000, 4,000 miles. Means same thing is for maintenance of the teeth. You go and get checked up. All we do is take an X-rays, do the examination, and do the cleaning. It's not a big thing, but the thing is for a patient is a phobia. They don't want to go dental because they are scared. You know, but the thing is when they are in pain, then they have no choice.
Well, and when
Scare
you
and
wait,
lack of
then you,
awareness.
Correct.
right,
Yes.
and then you end up in a situation where you have to deal with the pain and
Right.
all of that.
exactly.
Yeah. Okay. Thank you, Dr. Singh.
Thank
I
you.
think that's
Good
regarding the oral
information.
cancer. We would just take a minute to discuss about the allergies. Now, this is a month and basically season for the seasonal allergies. And we are reaching the end of the season for the flus and COVIDs.
I guess that's gone down considerably.
That's gone
huh?
down, yes. Compared to winter months, the number of COVID and flu patients have gone down with the rise of allergies patients. But we are still in the transition, like there might be overlapping of symptoms. We would like to stress on the red flags differences between the allergies and the URIs, which is upper respiratory infections, which includes both COVID and flu. Main thing is your seasonal allergies will not cause fever and body pain. Your seasonal allergies will mainly cause runny nose, itchy eyes, stuffy nose, or sometimes cough. But if you leave it like that without taking good care, it can end up with an asthma or bronchitis. That's at some point there you will need steroids and stuff, which we want to avoid. But in other case, if in URI, like COVID and flu, you will have fever, generalized body pains, in addition to runny nose, stuffy nose, and stuff. So whenever you have fever, that's something that you need to get checked. But if you're somebody who is sensitive to, who has a sensitive body or seasonal allergies, make sure that you take precautionary methods. Wear a mask when you go out. Have a glass with the seal. So it doesn't irritate your eyes. And also, if you're in the early stage of symptoms with allergies, make sure that you take your antihistamines and nasal sprays so that the allergies are not worse and lead up to respiratory failure or lung problems. That's the tip for our viewers in regards to the allergies and URIs. And Brian, do you have anything else to add?
No, all of that is good advice. I've actually I've had more allergies this year than I have in a long time. So I don't know if it's me or if it's just allergies are worse this year.
Oh, it's been bad. Even last year and this year has been very bad for allergies compared to the years before. And this year it's been much worse than previous year. Even I haven't seen that people without any prior history of seasonal allergies having severe symptoms with allergies this year. But the first time for them. So it's been pretty bad this year. Just take precautions, and you can't stop yourself from going out. So just take precautions and enjoy the warm weather.
Yeah, and I've found the nasal sprays and the antihistamines can help a lot.
Yes.
Is there a level where that's affected in your dental practice? Just
Yes.
you see people with
Yeah, people
hay
walking
fever
with allergies, they still wear masks,
Yes, yeah.
But sometimes they are sneezing and we can't work on patients who are
Yeah.
sneezing all the time.
oh, that could be tough, yeah.
With your, yeah. Okay.
Yeah.
Thank you.
Thank you.
All right, well,
Thank
I
you, Dr.
appreciate
Singh, for
both of you
coming
being here today, and I think that we've put out some good information. And as a reminder, both these practices you will find over by the Safeway, in the Safeway Shopping Center. Assure is at the end of the line right there when you come in the Safeway side, and Elite Dental is 2 doors down, right? You guys have the UPS store
UPS in
sandwiched,
between.
right? So if you're going to UPS, stop in one of these and say hello.
Right.
And I thank you both for being here, and we'll do another episode. Do you know what you want to do next time? Or
We'll need to brainstorm some topics.
see
We'll pick
where
up
we
a
are,
couple of
yeah.
topics and see if we can get a guest speaker. We will do that.
And if anybody has suggestions of what you'd like to hear from this panel, or our doctors in general, then please do let us know and put it in the comments. Like and subscribe, and do all the buttons. And we will hope to be back here sooner. I'd kind of like to, I may do something where we kind of review what's in the paper too, and I'll, kind of give you some highlights of that too. So stay tuned to the Mountain House Matters Facebook page and the MoHoTV on YouTube at Mountain House Matters, and we will do our best to keep you informed. Look forward to seeing everybody for the garage sale weekend this weekend, so it should be fun. And I want to thank Khalid for allowing us to be here and for running the board for us and doing all the stuff he does to make this happen at Zaytech. And we appreciate you. We appreciate all of you for tuning in, and look forward to seeing you again soon. Have a great night.
Thank you.
Thank you.